you want to introduce
Okay.
yourself to the internet again?
So my name is Sharon, and I had surgery 1 year. Remember?
Yes, I do.
1 year. 1 year this Friday, and it's been an amazing experience. It changed my life, and I can't believe I'm sitting next to the man who changed my life. I give you total credit. People say, "Oh, Sharon, I'm so proud." I didn't do anything.
Oh,
You changed my insides.
No, you had to have the strength to go through the packet, to prepare yourself, and I remember how nervous you were ahead of time, even the day of surgery. This was a pretty kind of scary time. And then post-op, I think...
I had a couple bumps in the road. I had gastritis.
Mm-hmm. And so can we talk a little bit about that? So in other words, what we like to do is we talk about all these complications and then I edit them out. Oh, wait a minute. But the idea there, of course, is we want to talk about the good and the bad. And I think, I don't know if we mentioned it for the internet or for the video, but you've lost a total of
120 pounds.
Yeah, so an applause. And so that's good, but you did have a couple of problems. And one thing was this gastritis. And gastritis, somebody asked me the other day on the telephone, what's the difference between gastritis and an ulcer? And the way to think about it that I think might be a good way to explain it is like a first-degree burn, a second-degree burn, and a third-degree burn. So a first-degree burn is like a bad sunburn. And so like I just got back from California, I've got a little kind of first-degree sunburn. That's gastritis. It's irritation, redness. It's not burned all the way through the lining of the stomach. It's irritated, it's bothersome, it's upset stomach, and that's first-degree kind of burn. A third-degree burn is they burn all the way through the skin, or in this case, an ulcer, and that is where the gastritis has gone on to become very severe. So you had kind of an upset stomach. Do you remember the symptoms or how
I remember
it was?
It was burning, and then I would throw up, and it was like a green
bile, right.
Yeah.
So you had burning feeling. That burn, remember first-degree burn, irritation, it's like a sunburn, and that is our biggest complication. Of all of our patients, we hate that. That's why we tell you the section in the manual, no aspirin, right? No alcohol, no cigarettes, because that risk is the big negative. The positives are, recent research shows, the chance that you're going to get breast cancer, if you're like the patients in the study from Canada that was just published, your chance of breast cancer is decreased by 80%. Pretty cool. Other kinds of cancers, similar decreases in this study. They look at 1,700 gastric bypass patients, compared it to 5,000 other heavy women in Ontario, Canada, and the risk of breast cancer over 5 years went down 80%. Other studies show that you may live 10 to 15 to 20 years longer because of that big change in weight. And it's associated decrease in blood pressure and pulse and decrease in risk of diabetes and high blood pressure and things like that. So there's a lot of good things. And I wanted to make sure I got that in before I started about the complications again.
Oh, that was not. And right away, he said, Dr. Rutledge said to call, not to wait, and I did. And as calm as can be, just take Prilosec, was it twice, double it
Right,
twice?
so we said that she had these symptoms of heartburn and things like that. So we said right away, that's probably some gastritis, because it's the most common thing we see. And we said, go to the grocery store and you can buy the Prilosec now, and they have the generic Prilosec is called omeprazole, so that's even cheaper. And buy that, and you take 2 of those 3 times a day for 2 weeks, and
That was it. It just went away.
How soon after?
plus we try and be available. Like right now I turned off my cell phone, but we try and be available on phone. And you said you called me and I was there, right?
Oh, you're in my
So we
cell
try and do that. I think, Ann, you called me a couple times, and I don't get all the calls, but try and get them. And so we do take care of people all around the country, so we try and be available. And the other thing I like to say is, why would you want to come from far away? I mean, you're from here in town, but why do people come from far away? Well, presumably one thing is, having done lots of these cases, I'm technically good at tying knots and making the cuts and things like that. And so that technical skill is important, you know, if your life depends on the stitching and the sewing, which it does. So that's a good thing, and I feel confident that my skills are pretty good because I've done a lot of these cases. But the other big benefit that I don't think everybody thinks about is that I have the cell phone, and there are 4,000 plus people out there who have this surgery. And they call me every day and they educate me. So I know what to expect, not because I'm that smart, but because 4,000 people are my teachers out there with cell phones and emails, and they educate me every day. So it's another good reason, we think, to take advantage of my background. I've taken care of a lot of people like you. So.
You are that smart, too. It's not just talking nuts. Then I have one other bump in the road. When was it? And it might not have anything to do. I had a kidney. They thought it was a kidney stone.
And what happened?
They never
Was it
figured
6?
it out. She had pain.
Mm-hmm.
I mean, horrible pain. She couldn't go to the bathroom.
Right.
And all of a sudden, she just said, "Oh, I'm fine." And they gave her some medicine. I don't remember.
They gave me morphine a couple times and it didn't do anything. Then
They gave her something. I don't
Toradol.
remember. And all of a sudden, she felt totally fine, and she was ready to go. I mean, she was like.
So that sounds like a kidney stone. Now let's talk. Kidney stones can happen after the surgery. Of course, they happen in everyone in the United States. I mean, it's a very common problem in the United States. There's actually what's called a stone belt across the middle America where there's a lot of kidney stones that happen. And it's one of the things that can happen in our patients. And most kidney stones are calcium stones. And so for years we thought by eating less calcium, you would have fewer calcium stones. And actually that research has been shown to be the opposite. The studies now show that by taking some extra calcium, you can decrease the calcium in the urine, and so that can decrease kidney stones. And so, of course, we recommend you take your Tums. This is one place where we have a slight disagreement with Dr. Paragli, because he recommends not Tums, but calcium citrate, because the citrate can help bind some of the other stuff that causes kidney stones. But we recommend Tums, and a good new research study showed that a very important thing you can do to protect yourself from kidney stones from calcium is to take orange juice. So every day, every morning, part of your breakfast ought to be fresh squeezed orange juice or something healthy orange juice. Not the fake orange juices, Sunny Delight or some of those other wacky things that are, there's an orange in the room when it's made, you know, that kind of stuff. So orange juice will help protect from those kidney stones because it has the citric acid and citrate in it to help bind that up.
Which was a big thing I started craving after surgery.
Yeah,
Orange
isn't that
juice
wild?
and grapefruit juice.
Mm-hmm. Good.
Amazing. So besides, those were little bumps compared to...
Now I forgot, did you get the estrogen patch?
No, I didn't need it, did I?
No? Just did great, huh?
He was
amazing.
nervous.
It was amazing because her hormones were out of control before, and all of a sudden after surgery, they got imbalanced. That surgery just put her right in balance, her hormones. So it was an amazing thing.
We came in after a week and we both, am I going to stay like this? I'm calm, and I felt totally, 2 days after, my knees, I would feel like an elephant coming down the stairs in the morning, and 2 days after, I didn't hurt, which was amazing. And then my hormones, I felt so even keel. Like, I would be so emotionally up and down, and right after, I couldn't even cry if I needed to. I was just across
Yeah,
the
because I
board.
think you were crying in post-op clinic.
Oh, I was
and, yeah,
for other people, for every situation. I was
Yeah.
just up and down.
Yeah.
And now it's amazing.
Wonderful.
Thank you.
Other questions that we should answer about what to do now. Are you taking your creatine? That's something that...
At this point, we are prenatal.
Mm.
So,
Oh,
yeah.
congratulations.
Well, let's say it didn't happen. We're on the journey of the.
Okay.
So we switched.
Oh, okay.
Sorry, we
Okay.
switched over to the prenatal.
Okay.
So I had to, do the visits. So now I'm at everything. Have stopped everything and just doing the prenatal.
Good.
So
Okay. Well, good.
yeah, let's.
I would ask your obstetrician if creatine is okay, because I think it'd be maybe good for you and baby too.
Okay.
But check. Okay. I hope that all works out well. We have lots of experience with women having children after the surgery. We've had lots of people who were infertile before the surgery and had trouble even being through failed fertility treatments that did not work. And we've had a lot of good results, a lot of good healthy babies after the surgery, so we wish you well. Yeah, good. All right, other questions that anybody else has to ask her before we let her go for tonight? Thank you for your appearance, and you
Thank
have a
you very
movie or
much.
book coming out.
Yeah.